Today we're going to be doing sculptra into the chest. That's right, sculptra into the chest. Our patient today wants bigger pecs, he wants more volume, he wants a more masculine and full physique. So we have sculptra, which is poly-L-lactic acid. It's basically a powder that's mixed with saline and other things to help activate it, and then it's injected into the dermis. Now you've seen me do this in the buttock often, but you haven't seen me do it in the chest. The procedure we're doing today is considered off-label. What that means is although the product is FDA approved, it's not approved for this particular use. So this is a newer use of the product. The goal today is going to be to build a prominent pec up here and to give him more prominence, more masculinity. Let's do it. So we'll be doing sculptra for you into the chest. We talked that this is considered off-label. What that means is although this product is FDA approved, it's not approved for the chest and we're using it there. I shared with you this is the first time I'm doing this treatment in this area. So we've given you the risks, which could be lumps, bumps, divots, irregularities. I've used this product in other body areas I haven't had that. We'll be careful, we'll be meticulous. And we're hopeful this will go well, but this is a new thing for me. Are you okay with that?
Yeah, for sure.
Okay.
Yes.
Awesome, thank you. Our patient already is pretty ripped today. What we're doing is we're feeling the medial edge of the pec and we're marking the lateral chest line. So we identify the area we want to inject. And we want to inject above the nipple to give more prominence. Our first step is identify the anatomy. We've marked the pec line border here, here, and here. We're going to highlight the upper portion of the pec. You don't want to highlight below, because if you highlight the below, it looks like more like a breast. So we're going to stay above the nipple, medial or in the middle of the lateral pec line. We're going to stay lateral or towards the side or where it's inserting, and we're going to fill in the muscle. We're going to work in quadrants. Now the first syringe is the least comfortable, okay? We're going to use this vibration thing. I'll put the chair up a little bit for you. Karan, do you want to go on that side maybe? Yeah. Okay. You ready, my friend? Okay, we'll poke on 3. 1, 2, 3. We're going to aspirate to make sure we're not in a blood vessel or not. We're slowly going to inject the product. How are you feeling?
Fine. Just pressure mostly.
Come on. A little bit more medial. Come on. Go more medial. Staying above the lungs. Okay. Perfect. So one done, one to go on this side, okay?
Cool.
We're going to start from the side. Now there is lidocaine in this. I know you know what that is. You manage that stuff. So what that means is you are going to get more numb with each injection. So the second one typically doesn't hurt too much. Go in the skin, get in position, aspirate. Aspirate means pull back. Make sure we're not getting a blood vessel. Make sure we're not getting air either. Alright, go into the middle. This is the more sensitive area. Doing okay, bud? Can I take a look at it real quick? Perfect. One and one. Now we're going to do another one up high. Putting 10 cc's per quadrant. Last one. Awesome. All done with the side, okay? So again, we're going to do the upper chest. 1, 2, 3. Poke. Aspirate. Okay. Do 10 cc's per quadrant. So now, what are the post-care instructions? So I prefer you don't work out today. Take it easy for the rest of the day. Tomorrow you're back to normal.
Cool.
To help avoid lumps and bumps, I like you to do a circular massage. So you'll gently massage like this for 3 minutes, 3 times a day for the next 3 weeks.
Okay.
So 3, 3, and 3.
Gotcha.
Me and you will do a follow-up appointment in 6 weeks, and we'll see where we end up.
Okay.
It takes 6 weeks to see the full results.
Gotcha.
Sound good?
Would you expect, I would think, like swelling and then to come back down, right, over
So-
the course of that time?
So right now the product is suspended in a mixture of saline, lidocaine, epinephrine. So it's going to look more than what you're going to end up with. Then it's going to look full for about 1 to 2 days, sometimes less. Then it'll shrink down to normal. Then it'll slowly come back up to 6 weeks.
Okay.
So you shouldn't have too much more swelling than what you're seeing right now.
Okay.
So what you see today should be maximal swelling.
Gotcha.
Sound good?
Yeah.
Awesome. Questions?
No.
So pain, soreness is normal. You can always call me, text me, you have my information. I'm here for you no matter what. Everything will be great.
Cool.